Okay, so 90 to 95% of back and neck pain comes under the category of non-specific in terms of the structures or the tissues that are actually causing the pain or responsible for the danger messages that's given us the pain experience. And that's something that we've been working through, and hopefully this has been able to be made sense of by you and the person that is your healthcare professional, whether it's me or somebody else. And what I want to normalize and give some information on in this session is if you fall into the 5 to 10% of people who have back pain, where we can be a little bit more certain around where and which tissues are responsible for your back pain and potentially your leg pain. And you may have had this described as or diagnosed as sciatica, or it may be what you're more familiar, or you may have Googled it. I recommend that you see a healthcare professional who will be able to do some tests, clinical tests, to be able to confirm that you've experienced that pain down your leg, and that is what we would describe as neuropathic pain. And that's something that needs normalizing, because a simple Google search, which I'll do with you now, returns some scary images around what can cause that. So I've just put in radiculopathy here now, which is the fancy word for sciatica. And sciatica is what we would describe as the referred pain that we experience down in the lower limb, and that can happen as well from the neck. In the upper limb, which can give us a presentation of pain down the arm. And this image here, if I just draw our attention to this, is where we're talking about the nerve root, which is carrying the information from our spine out of each segment, and a intervertebral disc, which is what gives us the ability to have all the movement and bear weight through our spine. Just like any other tissue in the body, like our ankles or like our shoulder, can become injured, and it can press on this nerve root as it comes out and then goes down to, for example, your sciatic nerve. And then it can branch off into different nerves and give you various symptoms. But what I want to draw your attention to here is the fact that we have got an injury here to the alarm system itself. Now, we've talked about, up to this point, reconceptualizing pain as an alarm system and how that can become sensitized. But what's an interesting difference with nerve root is that we can injure our disc from a heavy lift, or this can happen spontaneously over time. Can't always be too sure. But either way, we can injure the disc, injure the nerve root, which can give us the symptoms that you may be experiencing down the leg. And we can test the health and integrity of that nerve root with the reflexes and a thorough physical examination. But actually, we don't even need to have an injury. So this is a very frightening image here of a disc bulging to be able to press on this nerve root. In fact, all we need is a few of the chemicals of inflammation and around that nerve root, and it will cause you the symptoms of that leg pain or that arm pain that you may be experiencing. And this is an important thing for me to reiterate here, is that if we were to see a bulging disc like this and we scanned you in an MRI scanner, we could see it. We could scan you again in 3 months' time, and that's going to likely be 50% smaller. Scan it again in 9 months' time, and it's likely to be completely gone, and you're probably going to have a bulging disc somewhere else. We see these just as much in people with pain and without pain, but what really distinguishes whether it's clinically relevant is if it is happening and impacting one of these nerve roots, which will give you the characteristic presentation that has probably led you to get some professional help. Could be local back pain and or leg or arm pain. And what is often confusing about what is often confusing about having a diagnosis of a nerve root injury or sciatica, you'll hear these banded around, is because it's often very painful and very debilitating. And you will know if you have this because it will be often described as leg pain, as like an electric zapping, shooting pain. And I'll stop sharing that now so that we don't need to be seeing that image. Unfortunately, when you see some of those horrible images, if I don't have them, you can't unsee them. But I want to illustrate where that's often when we talk about neuropathic pain or your leg pain, that's where the injury has taken place, and we can be much more certain of that than we can with the non-specific back pain. And where it tends to be confusing for people in terms of I ruptured my shoulder last year. I ruptured my pec doing sports training, which was a big tissue-based injury that I had surgery for. And then as I was healing up and I would move my shoulder a little bit, my shoulder pain with the surgery would let me know, and I could be able to listen to that. That's helpful pain to guide my getting going. That is often how people will approach back and neck pain, with back off and wait to get going. And the difference with that, with what we often see in back and neck pain, is that the wait and see and backing off has often been how people have gone about things, and they've been doing it for a month, 2 months, a year, 5 years, 10 years, and even longer in some cases. And where I maybe have had a major injury to cause my shoulder pain, often the frustrating thing for people who have back and neck pain is that they don't have that one moment that there was an injury that we could say that it came on, and that's frustrating because it often doesn't make sense for us. And this then brings us into all of the different things that can set off the pain experience. That is this multifaceted alarm that can be set off by tissue damage, but also by other things that we've talked about, and we've got videos that we will potentially be discussing throughout this program. But where with a tissue-based injury, it's helpful pain to tell us to back off. The challenging thing is with persistent pain that's maybe come on for our neck and back, is that it's often less helpful to be guided by that pain because it can be overprotective. And by backing off, we ultimately can end up doing less and less, and that's very frustrating. So in that instance, we need to be able to find and have an agreed level of discomfort. Maybe we use a number up to 10, maybe we're using mild, moderate, severe for being able to have physical activity engagement, but we need to be able to cross this chasm, as we would call it, to be able to engage with the idea that tissue damage and pain are not one and the same. We've got other sessions to be able to talk about that. We can apply sore but safe, hurt doesn't equal harm, and we can start to have a level of engagement to be able to slowly get going, maybe doing some new things, maybe doing some different things for a while, learning some different ways to move. And that is a way that we will be trying to incorporate into navigating some of the maybe more unhelpful pain, because with the back and neck pain, we can't just back off. We know from the research that doing nothing and bed rest is the worst thing that we can do. We have to be able to be proactive and engage in these physical activities. Now, nerve root pain, as we've just illustrated here, is slightly different. And what your healthcare professional will try and explain to you is how, in that instance, we do seem to have an injury, and you'll have an individual history that maybe has led to a moment where that was the case, lifting something very heavy and injuring your back, just like we could injure a shoulder or we could injure a foot, or it could have come on apparently out of nowhere, and it could be something that's accumulated over time. Okay, now the extent of the leg pain and or arm pain that we get with an injury to the nerve root, like that image that we showed there before, is disproportionate to the size of the injury, because the injury, when you've injured your nerve root, is an injury to the alarm system itself. The alarm system, which is going all around your body, 400 nerves buzzing around to be able to protect us and pass that information to our brain and back to enable us to navigate the world. In this instance, where we've got sciatica or we've got an injury to the nerve root, it's an injury to that system, which is why it gives us a slightly different challenge to navigating, getting going with our physical activity and getting you back to the goals that are important to you. So understanding and appreciating that the leg pain and the symptoms that you're experiencing, which are very often very intense, we're going to look at the things that you can best do to help manage and approach the problem, both from your perspective and what you can expect from a healthcare professional. Appreciating that the fact that the level of injury or the level of pain is not a reflection of the size of the injury. Often our understanding is that the more painful something is, the bigger the injury, and that's actually not always the case. And firstly, coming to terms with that, with an injury to the nerve root, often normalizes it and can reduce the pain experience a little bit as well. Okay, but that being said, you'll have orthopedic tests that your healthcare professional has done, maybe lifted your leg up or done some reflexes that will help guide the process. Okay, but what our typical understanding of it will be that if I have injured my ankle, okay, or if I've injured my back, the danger messages that we've been talking about will then send information into our nervous system about danger for us to potentially have pain experience to be able to protect us. Okay, these messages are coming in. Remember, pain is an output of the nervous system always. It's not coming in, and if that's an unfamiliar concept, then we've got other videos in this in this rehab program that's going to help us get to grips with that as an idea. But I want you to try a little experiment, because this is this is an example of how we will help to understand the injury to your nerve root. So I want you to try and play. I've got a big jumper on here, but you've got an elbow, which is your point here, and then you've got another point that is just on the inside, and then there's a little groove in between. And in there's a little spaghetti type nodule that you can play around and find, and that is going to be one of the nerves that runs down to supply your hand. And you'll know this one if I was to ask you to recall a time you maybe banged your funny bone or your not so funny bone, because it gives you that electric pinging down your hand. That is your funny bone, which is the little nerve passing through there. If you press through that, you'll be able to reproduce the feelings going down to your hand. And this illustrates that these nerves, which can become trapped, they can become irritated, they go both ways. So they can pass information back down the hand, but they're also, you're feeling it, so your information's coming in as well. Okay, and that is an example of what's going on when you injure tissues like your ankle or your back, where you do a movement and that could be potentially irritating tissues that you've injured. Information comes into your nervous system. This is a cross section of your spinal cord, goes up to your brain, and then it comes back down, and through those nerves, that is how we get the bruising, that's how we get the inflammation, that's how we get the tissue healing. It's called the neuroimmune inflammatory response. And when we injure if we take this example, not from this funny bone here now, but we come up and we go into the nerve root, just like I illustrated on the video at the start, or this could be happening in your low back. That is one way that we can get these zings and zaps of your nerves that are sending information back down where they've come from to be able to give you that leg pain. And this is important to be able to appreciate. The plan of management we're going to talk about in a second, but appreciating that the extent of the pain that you experience and the size of the injury are not that well related, but it's the fact that it's our alarm system, it's our protective, it's our nervous system that is actually the part that's become irritated or injured, gives us that disproportionate pain experience, which as you will know is very debilitating. But understanding that can mean that it has less of an impact, because what is also important here now is that as that nerve root is connected to our alarm system, it's connected to the rest of our nerves, including our brain and including our thoughts, our emotions, and all of these, for the different ways that we've talked about in this course, can turn up our sensitivity for our alarm system to protect us even more or less. Okay, so being able to appreciate and understand this as an idea for making sense of where our back pain could be caused by a nerve root injury, really, really important, because what this will help us to be able to do is approach your management, both from a specific perspective for that nerve root and for a global perspective for how you're going to go about your rehabilitation. Now, this is something that I've pulled up here, which is the NICE guidelines. And these are the best practice guidelines for you to help. This is a patient guide for you to be able to ask the right questions and seek out the right healthcare professional to put a rehabilitation program in guiding you with what you need to be able to do. And if I just come down here, what you should expect and you should be able to find is a healthcare professional who can do a thorough workup for you, who can ask you questions about when it started and all the things that have contributed to what's led you to where you are today, and to do a physical exam to test the nerves, to be able to test the back, to be able to see what the extent of your symptoms and your injury and pain and how it's impacting you. Okay, because then whether you're seeing me or whether you're seeing somebody else, they should then be able to tailor a rehabilitation package to get you back to doing the things that you want to be able to do, that and will likely include significantly reducing your pain. Okay, often we don't need imaging, but if you have certain tests that are positive that could indicate that the nerve root is more injured, or there could be more of a compromise, then imaging might be appropriate. But that will lead us on to being able to put a conservative plan of management together before we would have more invasive things generally. Okay, so the exercises that your healthcare professional will be wanting to offer you will be things that will be, I can't say exactly in this video what it would be, but there would be exercises and movements that would be bespoke to you, that would be around this idea of being able to apply a movement-based approach for the nerves. You know, we know that the nerves can slide. We know that those nerve roots can move about an inch within their neural bed, and being able to use sayings like motion is lotion is really helpful for getting blood and oxygen to help soothe and ease those muscles. So you may be described some specific exercises that will be around nerve flossing, for example. You may hear and you may be guided through how you could do some movements that would involve some head movements and arm movements for being able to move maybe the nerves in the upper limb, or if you're in the lower limb, if you have sciatica down your back, it could be involved in head movement and movements of the leg that just get a bit of gentle movement through your nerve roots. And there's some specific rehabilitation exercises there that should hopefully help relieve and get a little bit of movement where it is probably uncomfortable for you. And if I just stop sharing that for a second to be able to pull up a really helpful image that I will be I can't tell if that's sharing now or not. Screen share. If I do that one, that's pulling up the NICE guidelines. Stop share. Screen share. Screen share. Okay, I can't pull that up. But what if I could pull that up? It would be an illustration of this idea of touch it, nudge it, tease it. To be able to engage with a little bit of discomfort around the idea that the extent of the pain that you experience is not a measure of tissue damage. You're not causing more damage, and we need to be able to engage with a little bit of discomfort to be able to work through and build towards the things that you need to be able to do. Okay, there may be some movements that your healthcare professional is able to guide you through, like bending forward, bending back, to the side, to the other side. And again, the idea of this would be to find the level that you're able to engage with, to do a little bit of movement regularly and slowly build over time. This idea of touch it, nudge it, tease it. That will be some specific exercises that are going to help move that nerve root. And alongside that, we're going to be building on the other concepts that we've been learning throughout this pain education in this program, like Restore but Safe, like tissue damage and pain are not one and the same. And then we want to be able to bring in some of the other components of your exercise for the reasons that we've discussed, like stress physiology. So being able to find exercises and activities that you find relaxing, that you find enjoyable, because they could be nice, have a nice impact layered in on top of these specific nerve root exercises. Maybe we can find some level of aerobic activity that gives us the chance to stimulate the internal drug cabinet in the brain. So what activities can we do to be able to do around the nerve root, specific nerve root exercises for you? There may be some benefit to discussing with your GP about some over-the-counter medications. So if, as I talked about with the impulses going out from the nerve root, that can cause a bit of what we call neurogenic inflammation. So if that's the case, and that becomes part of the perpetual ongoing pain, then some anti-inflammatory medications can be really beneficial and give you some respite in the process alongside this conservative approach. But if we can't find any relief, if we're not able to get any progress at all, then we would then have, or your healthcare professional could then be looking along the lines of things like steroid injections and more invasive care, lines of care, but they would always be reserved until after we've had a really good go at a conservative approach, first and foremost, because of the risks that are associated with, for example, in particular surgery and the costs and so on. So being able to have a package of care and a healthcare professional to help you make these shared decisions is really important, because when a nerve root can become injured, often it can take time, and it'll get worse, and then it'll get better, and it'll get worse, and we get this sort of Toblerone effect of days getting worse and better. And this can take and run over several months, which is why you need to be able to be proactive and in charge. You have a healthcare professional who's going to support you in having a flare-up toolkit to be able to have some relieving movements and relieving exercises and adapt your physical activity. Okay, the goal of being able to have a package of care gives us the best chance of helping your nervous system calm down, even if we have the diagnosis of sciatica, and to be able to calm the nerve root down, which we illustrated at the start there, which could have potentially been injured by something like a herniated disc that you may have even had confirmed on an MRI. But all of the other things that we've talked about in making this, and you in pursuing a global or whole of person perspective towards self-management, is going to be really important, even in this instance where we can be a little bit more certain around where the origin of the leg pain and or the low back pain is coming from, and that's the nerve root. Okay, so in terms of the specific exercises that you are having, it is about being able to have one more go at trying to pull up that. No, my infographics not going to pull up, but this idea of being able to touch it, nudge it, tease it with your movements is going to be really, really important for you to be able to regain function as soon as possible.